Aloha, I'm Rick Kwan. On KITV4 Island News Tonight, preventing severe COVID-19 symptoms.
I haven't had any serious reactions to it. Most people feel a lot better afterwards.
We'll tell you how safe and effective early treatments work. Maui County's top health expert under fire.
He has violated the very oath that he should have taken when he got his degree.
Why some lawmakers are calling for Dr. Lauren Pang to resign. Plus, what the doctor is saying tonight. Keeping employees and customers safe from the virus. How requiring vaccinations could impact private businesses.
The last thing we want to avoid is complete shutdown as we experienced last year. And many of businesses are still in the recovery period.
Trade winds return for our Aloha Friday. I'm meteorologist Pete Kajana. We do have some lighter winds in the extended forecast. We'll have that coming up.
And in honor of National Dog Day, meet the TSA's cutest canine. Her work on the 9th Island. With Mika Miyashima, I'm Rick Kwan. The news tonight starts now.
Now, covering all of Hawaii, this is KITV4 Island News Tonight with Mika Miyashima, Rick Kwan, and Chief Meteorologist Pete Kajano.
You are not a horse. It's a tweet from the Food and Drug Administration earlier this week asking people to stop using a drug meant to treat animals. Good evening and thank you for watching. Ivermectin is used to deworm animals like horses, goats, and cattle.
It has not been approved by the Food and Drug Administration to help treat early symptoms of the coronavirus. And doctors are warning that it could cause serious side effects or even death in humans. A feed store in Waianae tells KITV4 it's seeing an uptick in demand for the drug.
I have 6 boxes with 12 in each, and it's been gone for the last 3 weeks. And I only have 2 boxes left. People are saying that they can take it themselves for the ivermectin, and I said it's up to you, it's your choice what you want to do. Yeah, so if they're going to buy it, they can buy it at their own risk.
There are topical versions of ivermectin for humans, but it's used to treat things like lice, not COVID-19.
Local health experts do say there are safe and effective early treatments that have been approved by the FDA. KITV4's Atli'i Dukalo now joins us live with more on one medication experts say does work. Atli'i.
Well, Rick, the doctors I spoke with say the treatment doesn't beat getting vaccinated, but after using the medication on dozens of patients, they've seen little to no adverse effects and quicker recoveries.
These treatments reduce hospitalization risk by 70%.
Monoclonal antibodies. It's an infusion treatment that takes an hour to inject, followed by another hour of monitoring for symptoms.
What's really nice about monoclonal antibodies is that it allows us to attack the virus directly earlier in the course of the illness. So these are treatments that we give while people are still viral in the first few days of the illness.
Because the treatment begins days after people show symptoms, health experts say it allows patients to avoid developing a more severe illness. It can also help them avoid using other medication that could compromise the immune system and doesn't yield ideal results. Queens North Hawaii Community Hospital has been administering monoclonal antibody treatments for about a week now, dedicating an entire clinic for that specific care. Dr. John Dworkin is one of its lead physicians. He tells me the clinic can handle up to a dozen patients a day, but they're understaffed.
You need a separate space because the patients are contagious. You need some system for air handling. You need protective equipment for the staff that are in there. And you need the medicine. So it's a bit of an operation. And that's one of the reasons why it's been difficult for different hospitals to set it up quickly.
Despite the staffing shortage, Dworkin says the patient load has been manageable. He and other health experts are urging the public to trust health professionals and pursue appropriate database medication, including monoclonal antibody treatment, if they're referred for it.
Across the country, it's been shown to help people recover faster, to keep them from progressing to severe disease, to decrease the amount of time that they're infectious, and to decrease the rate of hospitalizations and deaths.
Over the last 4 weeks, Maui Memorial Medical Center treated nearly 90 patients using monoclonal antibodies, and it's seeing a high demand. A'ali'i Duklo, KITV4 Island News Tonight.